The following program is sponsored by Community Psychiatric Centers and is produced for educational purposes only. It is not intended as a substitute for medical or psychological advice, diagnosis, or treatment. The content should not be used for self-diagnosis or treatment of any health-related condition. As always, seek the advice of your healthcare provider with any questions regarding a medical or mental health condition.
Welcome to Community Psychiatric Centers Presents. Tonight we're talking about eating disorders, a problem that affects children and teens, both girls and boys. Eating disorders can be life-threatening, and during the next half hour we'll find out what can be done to help. But first, let's meet our experts. Dr. John Carasso is Clinical Director of Community Psychiatric Centers. He's a clinical licensed child psychologist and a certified school psychologist. And Dr. Robert Lowenstein is Medical Director of Community Psychiatric Centers. He's a board-certified child, adolescent, and adult psychiatrist, and a fellow of the American Academy of Child and Adolescent Psychiatry. Good evening, gentlemen.
Good evening.
Dr. Carasso, let's define exactly what constitutes an eating disorder.
Sure. An eating disorder is characterized by an extreme preoccupation with food and weight issues. It's a serious disorder, as you mentioned. It can be fatal, or at the very least, it can cause serious medical problems. It affects both females and males, but as we'll discuss later on, far more females than males. And while the disorder can be severe, even milder forms of the disorder can be quite debilitating and result in a lot of emotional distress and emotional drain. And of course, all eating disorders need to be addressed by a professional in a professional setting.
Dr. Lowenstein, let's talk a little bit more about the exact nature of the disorder. What are some of the symptoms?
Okay. There are two main types of eating disorders. The first type is called anorexia nervosa. This is a condition in which the person, usually a female, tends to starve themselves and lose an excessive amount of weight far below what is considered healthy for that person. It's accompanied by feelings of shame about their body appearance, a distortion about how they see themselves in the mirror. They often will look in the mirror and say, "I'm fat," when they in fact are very skinny. It's associated with lots of medical complications, such as the loss of her menses and other physical complaints, which we'll talk about later. In addition to the anorexic patient, we see patients that are called bulimics, who are the opposite. These are usually girls as well, who tend to binge huge amounts of food in short amounts of time, and then do something to try to eliminate the food from their system. It can include self-purging by sticking their fingers or their hands down their mouth. It can also include the use of laxatives or diuretics in order to lose weight. This also is accompanied by feelings of self-loathing, depression, a sense of incompetence, and sense of being out of control during these binge-purge cycles.
Dr. Carasso, what's the prevalence of eating disorders, and who do they tend to affect most?
Sure. When considering the severe diagnosable conditions, it's actually rather rare, maybe 1/2%, maybe 1% of the population. With people with bulimia, maybe 1 to 3% of the population. Of those, about 90% are females and about 10% are males, but the male population is growing, and we'll discuss that later on as to why. Anorexia is one of the most common reason for referrals for teenage females into clinics, and it typically appears in early to mid-adolescence. Now, those are the rates for the more severe conditions that are diagnosable. When we consider, when we broaden the scope and look at just the individuals who are struggling with food and weight issues, well, then the prevalence just skyrockets. Some of the estimates, over 1/2 of teenage girls and nearly 1/3 of teenage boys use unhealthy weight control behavior, such as skipping meals, vomiting, using laxatives to control their weight. But 42% of first to third grade girls want to be thinner, and about 81% of 10-year-olds are afraid of being fat. Moreover, 35% of what we refer to as normal dieters will progress and move into pathological dieting. Of those, about 1/4 will then progress into diagnosable conditions. And so again, when we look at the broader scale, the prevalence is quite high.
Also, this is one of the few conditions in psychiatry or mental health which can lead to death. And it's therefore a very serious condition. There's some statistics that go as high as 15% of severe anorexic females end up dying. So this is a condition which is quite serious. Sometimes it needs intensive treatment, including the use of hospital stay to break the cycle.
I think one of the things that you said that really shocked me was when you were talking about 42% of first to third
That's
grade
sad.
girls
That's awful.
want to be thinner. I want to ask you a few questions about that when we return. You're watching Community Psychiatric Centers Presents on PCNC.
At Community Psychiatric Centers, the help you need is just a phone call away. Led by Dr. John Carasso and Dr. Robert Lowenstein, Community Psychiatric Centers offer fast, thorough mental health evaluations for children, teens, and adults. And when it's time for therapy and treatment, trust CPC's professional staff of psychologists, psychiatrists, social workers, and therapists to put together a plan that works. Call 1-877-899-6500 today for a free phone consultation.
Think being a big sister means you have to spend all day stuck in a library? Think again. To learn more about becoming a big brother or big sister, call 1-888-412-BIGS.
Welcome back to Community Psychiatric Centers Presents. We're talking with Dr. Robert Lowenstein and Dr. John Carasso of Community Psychiatric Centers about eating disorders today. And I want to get back to that statistic that you mentioned. 42% of first to third grade girls want to be thinner. Where are we getting these numbers from? Because that's almost half. I mean, we're close to half of girls that young have a message that they think they should be thinner.
Turn on the TV and look at commercials, look at TV shows. The models are thinner and taller, and the girls in real life don't always look like models. And the push when you open up any fashion magazine or look on TV commercials is to be thinner and thinner and thinner.
And we're talking about, we see a lot of size 0 on TV, which is really amazing when you stop to think that, I'm not sure what the statistics are, but I had heard that an average woman is about a size 14 in America today, but you're looking at women who are a 0, and that is your role model, so very interesting. Dr. Lowenstein, what causes an eating disorder? What are some of the things behind it?
Well, we don't exactly know why it comes about exactly, but there are many factors that play into creating this diagnosis or this condition. One is a familial predisposition to it. There are social forces, which we just talked about, at play, which push young girls to become thinner, to improve their self-esteem by doing that. There are some biochemical causes that are being identified. It's still being researched today, dealing with the neurotransmitters in the brain, which help to dampen hunger. And there are also familial causes where the family itself sets up the child to be perfect, to excel, and to use their body image as a source of self-satisfaction for themselves and the parents.
Dr. Carasso, what about psychological and social factors that might contribute to an eating disorder?
Well, piggybacking on what Dr. Lowenstein just mentioned, the teenagers who struggle with this condition not uncommonly come from families where the parents have issues with control. They tend to overly control their teenagers' behavior. They will try to control almost every aspect of their life at times. The teenagers then act out, not aggressively, but more passive-aggressively by withholding food. And in a sense, they're communicating that you may be able to try to control other areas of my life, but you can't control what I eat and how much I eat. And the teenager then, just like their parent, tends to become overly preoccupied, as Dr. Lindsay mentioned, with appearance, with weight, with achievement. They tend to be perfectionistic. They tend to have issues with having a childlike quality, because if you don't eat, you don't grow. And so there's this almost a subconscious desire to stay childlike. Now, as for the more social issues that play into this, we just talked about some of those. Just to turn on the television set, as we mentioned earlier, we were talking about what the average woman looks like, and as compared to what we see on television. What we were saying, we were talking off the air, how the average woman is, 5'4", maybe 140 pounds. The average model is 5'11", 117 pounds. So that means that model is what, 98%? It's thinner than 98% of the average women out there.
There also is a pressure from in the sports world to stay thin or to become thin. There are lots of athletes, particularly those that deal with the singular sports, where the individual effort is more important than the group effort, where the wrestler or the jockey or the ballet dancer, which is like a sport, are encouraged to lose weight, to make their weight in order to succeed. And that kind of pressure is also what can create this condition at times. There also are some psychological conditions which predispose people to having this symptom, like girls that are depressed or that have severe obsessive-compulsive symptoms may be at risk for developing these conditions as well.
Sexual abuse, emotional abuse issues as well, low self-esteem can also contribute to that.
When you talk about self-esteem, I've talked to a lot of groups of young women, and that is a major concern that they have. Almost any self-esteem discussion you have, that comes into play. Let's take an email from one of our viewers. My 13-year-old son has always eaten well and seemed fine with food. However, since he joined the wrestling team, he is obsessed with how much he weighs, and he eats almost nothing. I don't know what to do. What do you think I should do?
It'll be important to maintain open communication with the boy. Talk with the coach. We want coaches to be communicating healthy competition, not win at all costs. We want possibly to bring in peers who have healthy eating habits, an uncle or brother to talk with this young man. And as Dr. Lindsay mentioned, there's tremendous pressure on athletes, especially wrestlers, for example, to make weight, but also keeping in mind that sometimes it goes in the other direction. They're attempting to emulate at times studio wrestlers or football players. So then they're compelled at times to get into steroid use and whatnot. So the unhealthy habits extend in both directions and can be quite serious.
What are some of the other personality variables that might affect whether a person develops these disorders?
Well, a young person who is particularly driven to success, who has obsessional thinking and compulsive need to be the best they can, are often caught up in this process. As we said before, children that are depressed, have low self-esteem, can also tend to develop this condition. Children with ADHD are known to also have this condition. Associated with this condition also, I must say, are the substance abuse disorders. A lot of the girls who try to lose weight will do so abusing substances as well, like they'll abuse the diuretics or the laxatives. They may then go on to other drugs which will help them lose weight, like the stimulants or cocaine or things of that nature.
That would be far more common in teenagers struggling with bulimia, who do tend to be more erratic in their mood and behavior, have the ups and downs, have more problems with impulse control.
I was going to ask you, if a person develops an eating disorder, is it something that's going to continue until it gets extremely bad and everybody notices, or can they kind of wax and wane and come into it and go out of it?
Well, it depends upon the person. The two types have somewhat of a different presentation. A child with anorexia may have a longer course, may start earlier and may last longer, in which case that's extremely difficult to treat. It's difficult to treat at all to begin with, whereas a girl with the bulimic may be shorter lived and may be encapsulated for a brief period of time, may occur only during periods of stress and then go away. Also, children go back and forth. They can have both symptoms at the same time, periods of self-starvation followed by binging and purging.
Are you in your practice seeing younger women, young children having this than you previously did in other years?
And seeing more kids who have preoccupations with their weight and with food and with very distorted perceptions of themselves, seeing themselves as overweight when they're not even remotely overweight. Increasingly common.
Also, what we're seeing is children who tend to self-mutilate along with the bulimia, cuttings, burnings, scratching themselves, hitting themselves in the head, sometimes accompany particularly the bulimic child. That, in a way, to take their, and also with the anorexic child, to take their thoughts off of food, to take their thoughts off of their problems, to focus on the physical pain rather than the emotional pain.
All right, we're going to take a short break. When we come back, we'll talk with some common treatment strategies that are available. Stay with us. You're watching Community Psychiatric Centers Presents on PCNC.
Every parent has sweet dreams for their baby, but what happens when the unexpected happens? When a child develops slowly, has trouble talking, or withdraws into a world all by himself? Today in America, an estimated 1 in every 150 children is diagnosed with autism. And while there is no known cause and no known cure, an early diagnosis can make a major difference in an autistic child's life. At Community Psychiatric Centers, Dr. John Carasso and Dr. Robert Lowenstein have more than 50 combined years of experience diagnosing and treating many thousands of children and adolescents with autism spectrum disorders. They, along with their highly trained professional and caring staff, can evaluate, diagnose, and treat children and adolescents who may be having problems at home, in the community, or at school. If you believe your child needs help, call 1-877-899-6500 for an evaluation at one of our 11 convenient locations in southwestern Pennsylvania. Community Psychiatric Centers, connecting you, your community, your world, one family at a time.
And welcome back to Community Psychiatric Centers Presents. A few questions for our doctors. Dr. Carasso, what are some of the more common treatment strategies that you have at CPC for eating disorders? Where do you start?
Sure. The goal is to address these potentially dysfunctional patterns that can be established within families where teens struggle with these disorders. So outpatient therapy is one of the more common approaches, where we work in family sessions with parents, siblings, with the patient themselves to try to, again, disrupt some of the patterns that have been going on for quite some time typically. Also, of course, individual counseling, working on coping strategies, helping the teenager to come up with alternative ways of managing their stress and difficulties. It's a team approach: therapist, psychiatrist, nutritionist, primary care physician. Now, for those who don't respond so well, it may require inpatient or residential treatment for those who are becoming dangerously low in their weight. And, of course, medication management can also be used.
Dr. Lowenstein, what about medication management? Where do you start? What's available?
Right. Well, the first thing you have to do with these conditions, particularly with an anorexic girl who's severely anorexic or has low weight, you really have to refeed the child first. Nothing can occur in a vacuum, so to speak. And the child who's severely anorexic, who's lost more than 15% of their weight, of their body mass, needs to first gain weight in order to really get into psychotherapy or get into family therapy in any successful way. So the first thing you need to do is establish a relationship with the family, a relationship with the primary care doctor, in order to set up a weight gain program that they can accept, also including the use, as Dr. Carasso mentioned, of a dietitian that can help the child to accept this. But it's very important that the family and the treatment team work closely to help the child to accept weight gain. Following that, we can use some medications and psychotherapies that we mentioned. Some of the there's no good medication for the treatment of anorexia itself. Some people have tried the use of antidepressants, which have not been very successful. They've also tried naltrexone, which is a medication used to treat addictions. That's been somewhat helpful. It's still in research. Treatment of bulimia is much more successful in that use of antidepressants such as Prozac and others like Prozac have been helpful in breaking the binge-purge cycle to some degree. Also, there are a number of children, as we said before, who come to this condition with other problems such as depression, anxiety, OCD, and those symptoms can be treated with the appropriate medications, antidepressant medications, anxiolytic, or the types of medications which are like the minor tranquilizers, which help to reduce anxiety and help in the short term only to help them focus in treatment.
What's happening in the brain to make a child who is so dangerously thin look in a mirror and see a fat girl or boy? What's happening? How do they get this image?
It's a body distortion.
Sure.
There's a condition called body dysmorphic disorder, in which somebody sees scars on their face when they might have one little pimple. It's a very serious condition when they get to that point.
Sure, and it's progressive. Keep in mind, this isn't something that happens overnight. This is something that has progressed from something that, again, may not have been diagnosable initially to something that grows over time, worsens over time, to the point where the child genuinely sees themselves as unrealistic.
Dr. Crosso, what can parents do? You know, as you said, we're turning on a TV or you're looking on the internet and you're seeing all these messages that keep reinforcing to the young girl or young boy that they should look a certain way. How do parents prevent their child from developing this kind of disorder when it's all around them?
Sure. Parents, it's a challenge because on one hand we want our children to be fit and to be healthy. At the same time, we don't want them to have an eating disorder. We want to encourage them and model for them appropriate eating, healthy outlooks on ourselves and the way that we conduct ourselves during mealtime, and we want to encourage those types of things, not attempt to control them. These the parents have to be very, very careful in the messages that they send their children, that looks and weight and appearances are not the end-all. And keeping in mind that we don't want parents to be withholding love, attention, affection based on how the child looks, or if they gain some weight, that then the parent withdraws from them.
There's a form of treatment which we utilize. It's called cognitive behavioral therapy. Cognitive behavioral therapy is when the therapist attacks the misperceptions, the cognitive distortions that a person has regarding their symptoms. So, for example, a child with anorexia has a cognitive distortion which says, if I gain 5 pounds, the world will collapse for me. I will be a nothing. I will be a failure. My life is over. And the therapist has to slowly and with great skill attack those distorted thinking patterns.
But keeping in mind, though, those thoughts didn't come from nowhere. Not uncommonly, there's something that progressively have been communicated within the family environment over the course of years, and that's something that in therapy we address and go after.
All right, we're going to take a short break. When we come back, we'll be back with some more of your emails right after this. You're watching Community Psychiatric Centers Presents.
Have you noticed something different about your child lately? Does your child seem withdrawn, unhappy, depressed, or prone to sudden outbursts? Your child may be suffering from a mood disorder, and it may be time to get help. At Community Psychiatric Centers, Dr. Robert Lowenstein and Dr. John Carasso lead a highly trained professional staff that offers mental health diagnosis, treatment, and therapy to children and adolescents. Call 1-877-899-6500 today for a free phone consultation.
Hey, you told me to call? So can I stay for another hour or so? 11. Okay, Mom.
Let your kids be who they are, but know what they're doing.
Psychiatric Centers presents, let's go right back to an email for our doctors. When I was a teenager, I struggled with an eating disorder. How much should I be concerned that I will pass that on to my daughter?
Well, the answer is there is a chance you can pass it on to your daughter, given the problems that you experienced, in that if you continue to be overly concerned with weight, with success in the world as defined by how you look, you could pass on those beliefs to your daughter. Not necessarily, because if you've gone through it and you've learned from it, then you're in some ways in a better position to help your daughter.
What about the outcome for most people who have eating disorders, especially children? Do they recover? What are the chances that they can go on to lead a normal life?
Well, it varies. The research seems to suggest that about half, both for anorexia and bulimia, half do pretty well. They recover and move on and can progress quite well in their treatment. About a quarter can continue to struggle and wax and wane in symptoms. And there's always that percentage, up to 5-10%, who can continue to have the symptoms and really struggle with them. And of course, as we mentioned, 5 or so percent of anorexics can actually end up being fatal. And so, again, a serious condition taken with the utmost of seriousness.
What can CPC do to prevent parents and teens who are struggling with these types of issues, to really help and prevent the problems from developing even further?
Well, the first thing to do is to establish positive goals for your child that don't necessarily include how they appear according to their weight, and to really support their children in their efforts to do well, and support them if they don't do well. And really, open communication is the best solution for these problems.
Sure, and when there's any concerns about eating habits and preoccupations with food and weight, call us. Call for a consultation. We can talk about the issues at hand and try to come up with a game plan for that.
You know, we talked earlier, you were talking a little bit about, it's really important for the intervention to take place and for the child to begin to eat. How difficult is that? It's one thing to say it, but how hard is it to reverse what's happening?
Well, in the beginning, it can be extremely difficult. These girls will refuse even small amounts of food and will struggle as if their lives depend upon it. They tend to control their environments entirely. Their parents are sometimes very at a loss as to know what to do, because they can't break through that child's control over their eating habits. It can be very frustrating. Sometimes we have to, as Dr. Grosso mentioned, we have to put the child in a hospital, have to refeed them. Sometimes they're tube fed, or IVs have to be put into place just to save their lives.
And we also have to watch young boys and men. That's something we really don't hear that much about, but it is, as you said, and especially with athletes, a concern.
It really is, and the idea of helping them to see that being the 260-pound lineman or whatever it may be is not entirely realistic, and there's certain limitations that we all have, and it's okay. We don't have to be 280 pounds to be the best.
All right. Doctors, as always, thank you for being with us, and thank you for calling. Again, if you have any questions for the doctors, remember to check out their website, cpcwecare.com. Thanks for watching. Good night.